Welcome back, America, to the Slice is Right podcast, all about plastic surgery and all kinds of fun stuff.
Welcome back, everybody. Good to see you again.
I'm Dr. Aldo Guerra with my trusty partner here,
Dr. Scott Ogley. Thanks for joining us.
dual board certified plastic surgeons, one board certified there, one board certified here. And today we're going to be talking about breast augmentation, my favorite procedure, Scott.
Yes, one of my tops as well. It's great surgery. I love it.
So we prepared a little outline here for you guys, and one of the reasons that breast augmentation is my favorite procedure is it's really the most popular around here where we live in Scottsdale, Arizona. Sunny, warm, just the perfect weather to enjoy beautiful breasts of many sizes and many different shapes.
Yeah, this is the place to live. You know, the pool season is over half the year here. Everybody's fit, likes to look good. So there's no wonder it's a very popular procedure at this practice and in Scottsdale.
Yeah, so let's talk a little bit about breast augmentation. We brought out some breast implants here. I'm going to hold one up because it looks like the camera needs a little bit of help. Yep. There it is.
See here.
So, what is a breast augmentation? I mean, how would you define it?
If the most general terms, it's just augmenting the breast to make the breast that the patient has larger, whether it's via an implant or whether it's with something like fat grafting, but it's just making it larger.
Yeah, so I would agree with you there that size is an important part of the equation. I think with the breast augmentation, we want to make the breast look more beautiful. So, size isn't, bigger size, smaller size, middle of the road size isn't always beautiful to everybody. Beauty's definitely in the beholder, but I do think that a fuller breast gets more attention. So people tend to think that, hey, bigger might be better, it might be more beautiful. I think shape is also something that gives a breast, a beautiful result. So I like to make mine natural in a lot of cases. When patients do ask for a more fake look, we also can achieve that. Cleavage, I think, is another part of the breast augmentation, which is much more popular now than ever before. Have you had any experiences with cleavage recently?
Yeah, I mean, there's always some common threads to most patients' requests. It's they want, good fullness at the top of the breasts. They want implants closer together so that the cleavage is better with and without a bra on. And so I think that's, that just shows a better looking breast that most patients tend to be drawn to.
What do you think is the best time to do a breast aug for like the average person?
I mean, that's a different answer for many different patients. Very regularly we have patients coming in here that are in their low 20s. They're just, they've dealt with small breasts that they're not happy with their whole lives. And I think for those patients, that's a great time for them to consider upsizing. But there's also patients that are in the middle of child rearing where they're 1-2 children in, they maybe want one more. And oftentimes I think that those sort of patients might need to wait a little bit until they're done with children. Yeah. So that, they can let their breast settle and determine if they're good candidates for implants and if so, when.
Sure. I totally would agree with everything you said. I do, having been here in Scottsdale for 20 years almost, what I see is that there's always a significant push for breast augmentations earlier in the year, let's say between January and March, so that people are ready to go to beach season, right? Or pool season if they're not going to be traveling out of town. But a lot of patients definitely travel once they get a breast augmentation, I think a little bit more than before. They feel more confident, they feel beautiful. Maybe they can enjoy a bikini now that they couldn't wear before with that feeling of great enhancement. So, but that's kind of what I think. I think most women, tend to do the operation between 25 and 35, and they tend to do it right before the summer travel season.
Yeah, this is when we start, seeing a lot more requests for breast augmentations right around this time because that gives patients time to schedule surgery, have it done, recover. Sure. And, we have pool season starts in March or April here. So this is about the time.
I mean, it's cold out today, but it's not cold around here very much.
I went to the pool in February before, so you never know.
Now, one thing about breast augmentation is it does take a little bit of time to recover. Most people need about 4 to 6 weeks to really be able to be in beach form.
Sure.
Can you tell the folks out there in America a little bit about how long does it take for implants to drop so that you look good in a bikini?
Yeah, that answer is like many other things. It's sort of patient dependent. I will say that no matter who the patient is, every patient will experience some form of implant spasm, muscle spasm, which leaves the implants quite high and tight right after surgery. And usually they start dropping within the first week or two without a real stable final result being realized for at least 6 to 8 weeks usually. Some patients take a little longer, some patients take a little less time, and it's really dependent on a number of things.
Yeah, no, I agree with you. That there's a couple of different stages. Obviously, you mentioned high and tight. We talk about with patients drop and fluff.
Drop and fluff, yeah.
I think minimum of 6 weeks before the implants come down. Now, there's a lot of my patients who actually go out in a tight, cute little dress within 2 weeks of the surgery,
Oh, sure.
and things look high and fake, but they want that look usually.
They look good still. Yeah.
Yeah. Now, most of my patients, want a natural, good-looking result. Maybe a little bit of augmentation. That's going to take about 4 to 6 weeks for them to settle it down. Let's feature one of your cases. I know you've done a lot of breast implants around here.
Yeah.
And I know that you love that surgery. So maybe we can put up a breast augmentation and you can give us some pointers about the work that you did here.
This is a great case because it highlights not only a great result that I've had, but also a patient that is a poster child for the dropping and the fluffing, where implants sit really high and tight early on and slowly settle in place over this progression here that you see is over, I think, about 3 months. So,
great.
Especially patients, like I said, some patients have a little bit hang around a little longer up high with the implants. Those patients tend to be ones that have a little more muscle tone, like this patient, a little more spasm to be had. And so, they settle in place. They always do, but some people take a little longer. And that, I think, is a great, a highlight of that.
So let's take a look at those pictures. So first of all, I want to just say that I love your result. I think it looks fantastic.
Oh, thank you. Yeah.
The other thing about this patient is she's not unique in the sense that we get a lot of athletic patients.
Yes.
People that work out and spend quite a bit of time in the gym. And I think those are a little bit more challenging of a case because the pec muscles are more developed. They're stronger.
Very.
It takes a little bit more massage, a little bit more time for them to settle. But she settled quite beautifully, and the expansion in the cleavage is very nice. It's really, I would say, a home run result, and it just fits her frame just so nicely. How did you help her decide on size?
Well, the sizing, how we do sizing in our office that I really like is it's maybe a little more simple than some places do. We put a bra on patients and we put implant sizers in until they're happy with the look that they have in that bra. And then, of course, we have to take that volume into account with their width of their breast, with the different shapes of implants in terms of profile, in terms of the type of silicone. And, that's a kind of a conversation back and forth. I don't want to just tell a patient, this is what you need. I want to teach them how the implants function, how they work, and then they're the ones actually making up the decision with me helping them along a little bit.
Yeah, so I like that. I mean, I like that you empower your patients to make their own decision, trying on different sizes. Now, people do try, like rise to bags and other things at home, but what do you think about the sizing system? You think it's more accurate, the one that we have here in the office?
Yeah, I mean, it really hasn't served me wrong. I think that it's nothing replaces just having a patient see physically on their own frame what that volume will look like. There's a lot of fancy softwares out there that do have a role that can show people in picture form, but this allows the patient to stand there in the mirror, look at every angle, feel how it feels, and so I think that there's nothing that really replaces that, in my opinion.
Sure, absolutely. Yeah, that does remind me to tell the folks out there that there is a good app that's made by a mentor that you can download on your phone. You can take your picture at home, and then you can play around with it, put different sizes. The one thing about those types of predictive power is that sometimes they do miss the boat a little bit, and maybe they don't always handle every single type of breast shape. The sizing system, on the other hand, I love. It's simple, it's easy. You can try a variety of different sizes very quickly in front of the mirror. One thing that I tell my patients, though, is that with the older generation silicone, the softer silicone, that it always looks a little smaller. Do you find that that's the case? And what do you find with the more cohesive gummy bear implant? Do you think that's the case with those?
Yeah, I mean, I think that the softer the silicone, the more it's a little bit more understated and hidden, versus silicone that is a little more well-formed, like the more highly cohesive silicones, like the Mentor Boost or the Allergan Cohesive. Those tend to push back a little more and show themselves better. So I think I agree with you on that front that the softer silicone can hide a little bit more.
Yeah, what I say is about 25 cc's for responsive and memory gel, and probably about just 10 to 15 cc's for these. But they all do look a little smaller. I don't think there's really a way to say that you're going to look exactly like what the sites are showing you. Now, one thing that's nice about the sizes that I do, and I don't know if you do this, but I always ask them at the second visit at the pre-op, bring your favorite top, maybe your favorite shirt or dress that you like, so you can see what you're going to look like. And if you love that same size twice, you know you're making the right decision.
Yeah, I think that makes patients like more reassured, because that's, you know, out of all the decisions you make with the breast augmentation, it's the size is really what I think a lot of patients kind of focus and perseverate on. So I want them to be sure that they're going into this comfortable, they made the right choice.
Now, over on the table here, we have just silicone implants, but, you know, women do have other options.
Sure.
There's really basically two other options, 3 total for enhancement. You know, you can use the saline implant. That's the old technology that's been around for 45, 50 years. And then there's fat grafting. Can you maybe compare and contrast those for us?
Yeah, well, you know, I would say that a large majority of the implants that we're putting in now, whether between silicone and saline, are silicone. Silicone technology has come a very long way. And the silicone of yesteryear that kind of got a bad rap is really not the silicone of today. So we do that pretty much a large majority of the time, but certainly we still do saline for patients, especially that have had saline before and are happy with it. And those silicone and saline both, I think, will give a very good volume enhancement that's, that's enough that patients will see a large difference. Those kind of are contrasted with fat grafting. Yeah. Fat grafting is, in the right patient, is, I think, an appropriate procedure, but by and large, it's going to give patients a much more underwhelming result in terms of amount of volume enhancement as the largeness of the augmentation. And I think most patients are not going to really be as happy as they would be if they got an implant, either silicone or saline.
Yeah, no, I agree with you there. So with my philosophy with fat grafting has been to really tell the patient they're going to get half a cup to a cup bigger.
At most.
And that's going to be sort of their max. If they really want to go from, let's say, an A to a D, which we're talking about 3 cups, you need silicone implants.
Yeah, fat is not going to do that.
Now, one thing that I've done that I really love to do is to combine silicone implants, or saline implants, as a matter of fact, with fat grafting to improve cleavage and improve the shaping of a breast. And so sometimes a woman will want an implant and they don't want to get that round-looking shape. They want a teardrop shape, and I think with fat grafting, you can soften it up.
Yes.
And cleavage is really very, very important, especially if a woman's pec muscles are very far apart. The fat grafting in front of that pec muscle can really bring that cleavage together. That has really paid off for me quite a lot.
Yeah, I agree. I think that fat grafting in and of itself as an end-all is not as powerful, but as a complement to implantation with one of these implants and in addition to fat grafting, it really does enhance the results. And there's a very like good role for it in what we do.
Yeah, the other thing is, fat grafting has been shown to be safe in terms of, cancer genesis. It does not increase the risk of a woman having breast cancer later in life. There are some changes that can occur on mammograms, like calcifications and oil cysts. But generally speaking, if you follow our recommendations to stay within a couple hundred cc's, you're probably going to avoid most of those. It's those people that are getting 400, 600 cc volumes in that breast that really get those oil cysts.
Yeah, those are the patients that tend to have a lot of lumpy appearance to their breasts, concerns on mammogram afterwards, or where they were just pumped full of fat to try to make up for not having an implant. Right. And a lot of that fat dies, scars down, and starts to feel like bumps, which is, for a lot of women, a huge concern in a breast. Sure. Even if we know it's benign.
Yeah, and then when we say that, breast augmentation is our favorite procedure, we're talking about breast augmentation with silicone, which we've been doing here for a long, long time, and we do the most in Arizona nowadays. All surgery procedures, including breast augmentation, can have complications, but we do a lot to decrease the risk for our patients. So, one of the things that I like to do is to get everybody off blood thinners. Anything that's an aspirin, ibuprofen, Excedrin, supplements like ginkgo, fish oil, vitamin E, I get them off of that for probably about 10 days for the non-steroidals, a month for the other supplements, and then we don't restart that for a month. Anything special else that you do before surgery to reduce the risk?
Yeah, I think just educating patients on what is, what activity restrictions they should be limiting themselves on after surgery to minimize the risk of problems, taking away modifiable risk factors like blood thinners, empowering them to walk after surgery to minimize the risk of blood clots. And those are the mainstays of making sure that, they're set up for success before and that they have the tools to succeed after their augmentation.
Nice. Yeah, that's really good.
Mm-hmm.
Let's look at, there's a picture here of a patient who has quite a bit of asymmetry. It's a case that we need to talk about because many women don't realize that they're different from right to left.
Mm-hmm.
And, the vertebra may be different, the shoulder position, they may have a little bit of scoliosis that may or may not have been diagnosed in the past. Do you find that pretty common?
I think it's way more common than most people realize. When you're actually looking at a patient standing straight with a very, picture that's like this, where it's very standardized, straight on, I think women are very often surprised that they have a little bit of tilt to themselves, or that one breast is higher than another that they've never really noticed. Because those two breasts look very similar apart when you're looking at them individually, but together on the chest wall, taken with the patient, you can see that there's actually quite a number of differences to that patient.
Yeah, when I look at this picture, it reminds me of, the typical situation that I see where the left is a little higher than the right.
Mm-hmm.
Do you think it's because they carry a purse on the right side?
Yeah, maybe. Who knows? Yeah, I think it's scoliosis. It just, a lot. The body is two halves put together as one. And so a lot of patients, there's subtleties. And it's important to point them out because it will influence the symmetry that they're going to have after surgery. So that's our job, is to point it out.
Again, a patient will look at their breasts once a month before surgery, but 50 times a day after the surgery to see how they're growing, see how they're changing. Mm-hmm. Now, let's talk. I'm going to show one of my cases up here, and I want you to just give me your honest opinion on this result here. So, can we get it up on the screen?
Well, yeah, it's a fantastic result, given that, before they started with great symmetry, but they ended with even more improved symmetry. Great upper pull fullness. The cleavage is excellent, not too over the top, but just in the right spot. Implants have settled really nicely and filled out the breast just as they should. So, I think it's a slam dunk.
Yeah, I think, for that technique, I used a dual plane under the muscle, dual plane type 1, just really nice. Basically, what that means is that we're releasing the muscle at the rib margin, and that allows the implant to really get into the cleavage and get down at the bottom and really fill out. Ultimately, what that does is also distribute the volume, so it's about 50-50. Half of the implant is above the nipple, half below, giving the patient that mysterious look is what I like to call it. Sometimes natural, sometimes augmented.
Make people wonder but not know. And exactly, you get the benefits of being under the muscle without the fully being under the muscle, like a lot of extra animation or making the implants bounce around a lot when they use their pec muscle. So that's a technique I use as well, and that's a fantastic result.
Absolutely. Now I'm going to throw some terms at you here, Scott, and then just let me know what is the first thing that comes to mind when you hear this. Mm-hmm. Pariaxillary liposuction.
Well, first thing I think of is it's a great adjunct to breast augmentation, and a lot of women would benefit from it. They don't realize that they would benefit from it. Like this patient right here.
Yeah, so we're lipo is something we're going to be lipoing something during surgery. What are we lipoing here?
Well, pariaxillary fat is the fat that kind of sits right in the armpit, right above and outside of the breast. Sometimes it can even be a little bit of breast tissue. It's regardless of what it is, there's fullness there that can cause a little bit of unbalanced breast, lead to fullness and a little bit of widening of the chest that patients don't want. So, in and of itself, it's a great procedure, but especially combined with an augmentation, it really just changes the balance and looks a lot more aesthetically pleasing afterwards.
Yeah, so I call that area the sleevage area.
I like that term.
I've had so many patients just be so much more excited for that fat pad to be removed than their implant sometimes. It's amazing how happy they are.
They only think of it as something like just a little extra skin that kind of bunches up when they wear a bra, but I think the implants can really make people realize that that's there, and treating it at the same time is just a slam dunk.
We can see that's the before right there that we're showing on the screen. Let's show the after, and you can see the difference. So what I see afterwards is beautiful round breast, amazing cleavage. The volume is distributed really great, and then those little fat pads that were there in the before picture, they're gone. They're gone, and they just look. She just looks so much more attractive and thinner. And I think it gives a woman just so much, and it's a little lipo incision, right? It's just very
hidden right in the armpit that you wouldn't even be able to find it probably in a few months. It's that subtle,
and it doesn't increase the recovery. It just goes right along for the ride.
Just along for the ride, exactly.
How about mesh insertion?
Yeah.
Did you think I was going to ask you that?
I feel like it was written right here, but
that was a big clue.
Yeah, that was my spider senses were tingling.
There
But
you go.
yeah, I mean, mesh has. I was a little bit hesitant when mesh first came out. You know, I don't just adopt something the second that it comes out as if it's the hottest new thing. I want to make sure that it's tried and true, that it has good risk profile, that it actually does what it's intended to do. So this mesh, now that it's been out for a while, that it's been used a lot, I'm a believer, and it's not something that I think is necessary for everybody or even most people. But there are a certain number of candidates that are going to benefit from mesh insertion with breast augmentation or with revision breast surgery that this will really help them in a way that we couldn't really do that before this came out.
Right.
What are your thoughts on what patients you seem to think are best with it?
My number one reason that I use mesh is on a revision case where I see that the implant is just not being held up by the tissue. So sometimes we call that bottoming out,
Sure.
or maybe lower pole stretch. But that's the number one reason. Second reason has been with, and I get a lot of these patients who have lost a tremendous amount of weight and they have increased elasticity in their soft tissues at the mammary fold, and you can just see on exam before the surgery that it's just not going to hold up the weight of the
They're going to drop
device.
out, you know it.
That's a good reason. Now, in breast dogs, I don't use it as much. I don't think a lot of people are out there who are young, healthy, in their prime, 25 to 35, who have very weak tissues, unless they've lost some weight or maybe they've gone through some kind of medical therapy that has made them weak in some way and they haven't fully recovered there. But so I would say, number one, for sure, revision surgery, reposition the implants with better cleavage, better fullness up at the top, and then with the lifts.
Yeah, you talked about not being many patients that are going to be good candidates as primary breast dogs, and I would agree, because most patients that are loose tissue-wise often are going to need something more, like a lift as well. But there are a subset of patients that are never had breast surgery, are good candidates for augmentation, or are right on the cusp of an augmentation and a lift.
That's a good
point. I just did a surgery recently on a patient who really didn't want a lift. She was kind of right at the edge of needing a lift and not. And those are the patients you worry most about implants settling too much, becoming too bottom heavy.
Sure.
And I used mesh on her. And she had a fantastic result. The implants stayed high. They still filled out the breast properly. And that was a very good example of a patient that, a unique patient that could do really well with that in a primary breast augmentation like we're talking about today.
I love it. That fellowship training. Like when he was doing fellowship, they were doing mesh, I don't know, 8 times a day or something?
Well, we did use a lot of mesh. And so that's why I really started to see its the diverse ways you could use it. I still think sometimes people use it a little more often than they necessarily need to, but I think there's a great role for it now, what we do, and I'm happy to say that we use it and that we have a tool like that in our tool chest.
Yeah, well, another tool that we have is the Keller funnel. We think that decreases capsular contracture. So capsular contracture is that fairly uncommon problem now where there's too much tightness around your implant. Your body makes too much tightness around the implant. Funnel helps to avoid it. That's part of the 16-step approach. Also, triple antibiotic solution. I'm a big believer in all those studies that have been done over the past 30 years where betadine combined with Ansif and gentamicin antibiotics makes a big difference in reducing capsular contracture.
I think we do the exact same thing. And, I'm all about things that are tried and true. If things have been proven to work, if they've been shown in studies time and time again, I think we should use them. Yeah. So, this is, I think, a good example of what contracture can look like on the left side of that image there in the before picture, and what often has to be done through surgery and releasing of the scar tissue, placing new implants, showing what it looks like without a contracture. This is your result. It looks awesome.
Yeah, she's got a very nice result. Yeah.
So we obviously want to avoid that in the first place. It does happen. It's the most common complication of breast implants. With all those different steps that we take to minimize, probably get it down to about 1% or less. But, that's by doing the things that we know work, we get it down as low as possible.
Excellent. So it used to be more common, back in the 80s above the muscle augmentation, which we rarely do nowadays, maybe 10 to 20% chance. Now we're getting it down 1 to 2% with the funnel, under the muscle, with the mammary fold. And you believe in nipple covers? You know what those are?
Absolutely. That's part of the 16-point plan, and I use them because I think it makes the sterile field more sterile. Absolutely. The more sterile you are, the less likely you'll get a contracture. That's been proven time and time again.
So a nipple cover basically is a little sticker that we put over your nipple after you go to sleep under anesthesia. What it does, it keeps anything that lives inside the milk ducts throughout the entire case. Sometimes if you push from below, you could aerosolize bacteria and other particles, which we don't want that to get on your breast implant. So most of the surgeons I know use a nipple cover. They think it's really important. Every once in a while, I forget to take it off at the end of the case, and the patient comes in, and I say, hey, you got a sticker.
Yeah. Hey, there you go.
You know, when you go to the pediatrician, they used to give you a sticker. Well, we do that too.
It happens, but the fact that we're using it is the important part.
That's
what makes the risk of contracture lower.
All right, so let's talk a little bit about, we're here.
Switching gears.
We're right next to the waste management.
right next to it.
Right next to
so
it.
So close it hurts.
Don't come and park in our parking lot. Don't get towed. But but it is a lot of fun. Are you going to go this year?
I think I might. I might sneak away during the week at some point when it's not so crazy. My younger years I go and maybe partake in some of the festivities. Now it's too much of a zoo. I got to stay back and go earlier in the week when it's more about golf than about getting drunk and partying.
Yeah, and then we got Valentine's Day coming up here very, very shortly, and I will let you know that there's nothing, there's nothing out there that makes a woman more happy than when you give her new breasts and you buy her breast implants. And that's a gift that keeps on giving back to you, by the way. So think about it.
So make your appointments now.
Think about it, guys.
The busy season is upon us, so there you go.
We have a great Valentine's special. We call it the big deal. We do it every year. And you should check that out on our website at myfaceandbody.com so that you can find out. And we also have, turns out the Super Bowl is going to be around the same time as the end of the waste management. So this will be a ton of activity.
It's always a madhouse, especially last summer when they were both happening in Phoenix at the same time. It was a little wild. At least we get a little quieter this year.
I just want to say, I want to thank our sponsor, Diazepam.
And Botox.
Thank
you. No.
Also, this is sponsored by Guerra Plastic Surgery here in North Scottsdale. Want to just let you know that you can find us on YouTube. This is our second rendition. We're very proud to be here. So when you get on YouTube, make sure you hit the subscribe button so you can see us in the future, and hit notifications so that you know when we're loading up new podcasts, which we're going to start to do them on a more regular basis.
Yep.
Also,
more to come.
Follow Dr. Scott Ogley, MD, at Instagram, and Dr. Aldo Guerra, and follow AZ Breast on Instagram if you want to know more about our promotions and what we're up to and what surgeries we're doing on a daily basis. So
befores and afters, all that fun stuff.
We're putting a lot more before and afters than ever before. Yeah. So we got a really good team working on those. I want to thank everybody for their time tonight, and be safe out there. And, thanks again for checking us out at azbreast.com.
Thanks, everyone. Have a good one. It's nice seeing you.
The slice is right.
The slice is right. You know it.
Whole life's ahead of you.